Prepare for what's coming and dominate in economic winter. Stand strong and thrive by showcasing your great products and services globally through the Black Business Network and Black Business Olympics. The Black Business Network has showcased over 2,000 companies with over $7 billion in sales each year. Over 10 million attendees have viewed the rebroadcast each month. Through the Black Business Olympics, unique styles of business training and mentoring are turning students into business owners and entrepreneurial warriors who will dominate in any economy. Gain the ultimate advantage of the Black Business Olympics, 7 days of unbelievable topics and speakers speaking around the globe. Donate your time and experience to provide expertise and scholarships to students worldwide and change the world. Now, more than ever, new insights, tools, strategies, and capabilities are needed. This is your chance for a major presentation to the world. Fill out the form and join the more than 2,000 speakers who have presented to over 200 countries. Join the Black Business Network streaming live into the Metaverse, STEM City, Black Multiverse Enterprises, Hulu, Amazon, YouTube, iHeartRadio, Apple, Facebook, LinkedIn, Pod TV, IBM TV, Spotify, and Google Podcasts. Sign up today. Spaces are limited, and we will see you there.
Hello, everybody, and welcome to the Mary D Talk Show. We are here with another beautiful Monday. Those of you that, whether you're in Southern California, wherever you are in the world, it is beautiful. Believe me, it is, because we are here. That's a blessing. We get to celebrate another day. Boy, it's exciting. I'd like to first thank our executive producer of the show. That's my husband. Hi, babe. He's in the background. As many of you know, that's Oliver. And if it wasn't for him, it probably wouldn't even be a show because he encouraged me so much to go live and been going live ever since. So thank you. I'd like to thank you to our live viewers. Hi, live viewers. Thank you, our replay viewers. Hi, replay viewers. All of you, the replay viewers, I'm going to tell you because I'm so excited. You guys come on and you support. You go on and you subscribe. The subscription rate is now, or the subscribers are now over 5,000. That's due to y'all, you guys. That's all of y'all, not live viewers, but whether you're live or you replay, whatever, it still makes a difference. Just want you to know that. I want to say hi to, I see Antonio. Antonio is a super fan. So Antonio and Lori, I want to make sure I say hi to you guys too. Ladies and gentlemen, we have an exciting guest today. When I tell you exciting, she'll tell you, I think I've been trying to get her on for about 2 years now, but she's so busy. And just to get her time today, I was like, wow. So for her to come on and spend time with us, when I tell you it is a blessing, it is a blessing. So before I even go, I'm gonna actually go on and tell you a little bit, read her bio to you, because I want you to really get an idea who we have here today. We have a powerhouse of a lady that's here. Her name is Dr. Leita Harris. She was born in Panama and raised in New York City and has been living in the Inland Empire of Southern California since 1986. She's the oldest of 4 children. I don't know if she knows I'm the oldest of 5 children, but anyway, we're 2 oldest of 4 children. And she was determined at an early age to pursue her education and become a physician. She graduated from New York University. She received her medical degree at Cornell University Medical College and completed her residency at LA County U.S. Medical Center. Wow. Dr. Harris has been a practicing physician in women's health as a gynecologist since 1990 and is a leader in the field of managing hormonal imbalance, including perimenopause and menopause. She currently has her own private practice, Nurturing You Nurturing You Women's Health and Wellness, and which serves both men and women, and has previously worked in Riverside Medical Clinic, Kaiser Permanente, UC Student Health Services, and as an associate clinical professor at UCR School of Medicine. Wow. Tough, tough, tough. In addition, I'm sorry. So she continues to stand. I want to make sure. Oh, I'm wrong. I went past the section. I think I did. Here it is. Her current service activities include president of the J.W. Vines Medical Society, board member of the J.W. Vines Foundation, among others. She is a sought-after speaker on women's health in the community. She was blessed to be united with her husband, Bishop John S. Harris, and joined with him in launching Castle Rock Christian Fellowship Baptist Church in 2001. And I've been to their services. I can tell you, they are just outstanding. She continues to stand in loving partnership with her husband and pastor, faithfully serving her church family in many capacities, including church administrator, Sunday school teacher, women's ministry leader, and previously as the director of the Daughters of Excellence Ministry, a mentoring ministry for young ladies ages 11 to 18. She is the blessed mother and stepmother of 5, JC Barron, Tyler, John II, Brandon, Kaylee, and Kaylee. And her passion is to serve the Lord to her fullest with excellence, knowing that God alone will be glorified. Ladies and gentlemen, welcome to the show, Dr. Leita Harris. Dr. Leita, are you there?
I'm here. Hey there, Sister Mary. Hey there.
I'm glad to have, so honored to have you, because you have, and you probably don't know this, but I've been a fan of yours, and always, every time I see you, I'm always glad. We're always hugging. We're always just so much love. And at the same time, I would ask you to be on the show. You go, not right now.
Well, the time has finally come. The time has come.
Welcome.
The time has come. So,
we're gonna. What I'd like for you to share. I know I gave a quick overview.
Sure.
You can tell the audience about yourself, and I'm here, but I'm behind the scenes, so I'm gonna put the screen with just you.
Gotcha. And by the way, check your email.
Okay.
So, honestly, I think the sentiments are likewise. I've been very much admiring what you do. You're certainly a persistent one, just kind of like step in and just doing what you do and making a platform such as this to be able to be a blessing to so many people. And honestly, it's been to my detriment that I have not been able to come on earlier, sooner, because something like this is so important. We need to spread the information, spread the news, let people understand the importance of what we're going to be talking about today. And I'm extremely passionate about what I do. I know you mentioned a lot about the various things I do. My passion is to really help people to live lives full of vitality, to maximize and optimize their health in any way that they possibly can, so that they can be the best version of themselves, that they can feel the best that they can feel, and they can be the best person that they can be for the others in their family. And unfortunately, I think too many people function at a suboptimal level. They're just kind of being existent, and really they don't even understand the changes that their body are going through during this particular time of their lives. And our purpose today is to really help people to not only understand what's going on, to help them understand what can be done in order to, again, help them to be the best that they can. And also, even if someone's on the call or listening afterwards and say, hey, well, I'm well past, I don't need to worry about that stuff right now. But the information that you're going to get today is going to be something that you can help someone else. So whether it's your niece, your granddaughter, your sister friend that you work with, your coworker, and family member, the information is imperative for you to have, so that way you can be able to listen to a sister friend, listen to somebody else, and hear the kinds of things that they may be going on, they may be having experience in their life, and be able to say, you know something, why don't you check this? Why don't you check and see whether or not this may be due to your hormones, etc. So, I've been practicing, gosh, like you said, since 1990. I've gone to various places, but back in 2015, so almost 10 years now in June, I've been on my own. And it was very sacrificial, as you can imagine, because, when you're in the secure place of working with a large multi-specialty group, as you see where I've been before, you have security. But I felt like I wasn't able to really be a doctor that was able to give people options to really help them in a way that I feel like I can help them now, looking at things from an integrative standpoint, from a holistic standpoint, giving people the time that they need, as opposed to letting them feel like they're turnstile, and that people are not listening to them. They're not hearing their concerns. And by the time they're ready to really express themselves, the doctor's hand is on a doorknob and they're walking out and they're ready to see the next person. And I was like, been there, done that. I can't do that anymore. So I went out on my own, nurturing you, women's health and wellness. And yes, you said I see men. So, which is, hey, I see men. I got trained on how to take care of men as well, with low testosterone, et cetera. And so I actually have a nice broad patient base, but my passion is to really do medicine in a different way than the traditional way.
Right. Right. Well, I want to tell you, I know that the need is really great. As I mentioned to you before, I am literally positive there are symptoms that I have had and didn't recognize. They were that I could, attribute it to this. I had no idea because I just didn't know. I know too. I think I'm able to upload your part. Let's see.
Yeah. Okay. Great. Great.
So I know, is that, and I know this is probably, the audience, let me do this before we get started. I want to say to our audience members, because I let all of you guys know, you're all special to be here. So hi, Antonio. Antonio says, hi, Mary. And then he goes, hi, Oliver. And then we have here, who's this? Miss Dimple 28. Hi, Aunt. I think that's what I call Pretty Girl. Hi, Pretty Girl. This is my niece. And this is Antonio. She said, I can't wait. Oh, you see, you can't wait, Antonio? Antonio's been on the show before. And this is Nanette. Hi, Nanette. Nanette, I missed you. I didn't see you last week. And then this is Elaine. Elaine says, hello, Mary, Oliver, and Dr. Harris, with all of your guests. Oh, thank you, Elaine. I call these super fans. And they come literally, when I tell you, that's why I said Nanette was missed. I didn't see her last week. Normally she's here. So I will tell you, thank you to all of you guys for being here today. You're in for a treat. So I'm going to now turn this back over to Dr. Leita.
Okay, great. Very good. So as you see, it says this is not your grandma's menopause. So we really want people to understand that times have changed. Of course, our bodies are bodies. We go through the changes, during certain times of our life. And, the problem is that too many people, as we said already, don't understand what's going on. So we need to support women as they go through this transitional time of their life, and being able to understand the information is the first step towards, helping to support. So I guess you're controlling the slides, right, Sister Mary? Yeah. So the next slide, basically,
keep going.
Yeah, that's like, okay, there we go. So this is basically showing, hey, diversity. There's women over 50, every single woman is going to go through menopause. And I say that very intentionally. Every woman is going to go through menopause. Now, and I say that because people say, oh, well, I didn't go through no menopause. And I'm looking at this lady and she's like, looks like she's 80 years old. I'm like, okay, are you still having your periods at 80 years old? And they're like, no, I said, well, then you went through menopause, because menopause, everyone goes through menopause. Menopause is not this determined or defined by whether you have symptoms or not. So if you're blessed to be able to go through this transition and not really have any symptoms or anything like that, then wonderful. But that doesn't mean that you didn't go through menopause. So every woman is going to go through menopause. Okay. So the next slide is going to basically show you what kinds of things. No, we're looking at this. Okay. Here we go. We need to do the custom show that says Grandma Menopause, not the full thing, because I have several different ones that I have.
I don't know. Let me see. I'm going. Where am I?
No, yeah. You're starting from there. You got to do the custom show.
Oh,
We can kind of go down, unless you want me to go ahead and try to do the share screen again. I don't know if that's going to work.
Well,
it has to,
just take it down.
Yeah, just take it down. That's okay. We'll just talk. Because it has to be the custom show. I have several PowerPoints under this. So basically we can just chat. Okay. And if people have questions or anything like that, we've heard. So menopause itself, average age of menopause is anywhere between like 45 to 55 years old. So average age of menopause in America is like 52 years old. So early menopause is anything before 45, but then you can have women like all the way up to 58 or so that are still having their cycles. It's defined when the ovaries stop producing hormones, when there's no longer any ovarian function, when all of the hormones have declined. We have a certain amount of eggs, a certain amount of duration that your ovaries are going to produce hormones during our reproductive years. Okay. And when that ceases, that's when someone is, done with their ability to, ovulate, to be fertile, etc. So that's when that happens. Now, leading up to menopause is the few years called perimenopause. And that is defined by irregularities with the menstrual cycle. So you can be skipping periods. You can have 2 periods a month. You can have short cycles. You can have long cycles. You can have any variety as far as that's concerned, still having some cycles. But what's going on at that point in time is that the ovulation is becoming more and more spaced out. So that's where the skipping happens. That's where other symptoms can start as well. So you can start feeling some of the symptoms that are related to menopause, even in that perimenopausal phase, and still having cycles. Okay. It's just a really like roller coaster time, if I could put it that way. Okay. So just to go over again, some of the symptoms related to menopause, and this is again related to the hormonal decline. People always think like menopause is hot flashes and night sweats.
Right.
That's what everybody's familiar with, hot flashes and night sweat. But what folks don't understand is that there's so much more going on in their body. So think about symptoms like anxiety, like depression, like sleep problems, either difficulty falling asleep or difficulty staying asleep, mood fluctuations, decreased libido or sex drive, okay, low energy, high fatigue, hot flashes and night sweats, physical changes, weight coming on out of nowhere. Nothing's changed with your diet, nothing's changed with your physical activity, but here comes weight, particularly in this midsection. Okay, memory, focus, concentration challenges, what they call brain fog. Okay, you use hard to find the words at the end of your sentence. You go into the atmosphere somewhere. You lose focus. Again, memory. So these are very much things that happen as well. Joint aches, joint pains, skin changes. Dryness of your skin, dryness of your eyes, hair changes, hair loss. Okay. Vaginal problems, vaginal dryness, thinning of the vaginal tissue, urinary symptoms, more frequent going to the restroom, susceptibility to urinary tract infections, etc. Painful intercourse because it's dry, it's thin, etc. Loses elasticity. And honestly, I could go on, but that's a pretty significant list.
It is.
Okay. And it's all related to hormonal decline, hormonal fluctuations. And I bring these up because patients will go. They'll go to their primary doctor or even a gynecologist who may not have been fully trained, because, you know, I wasn't fully trained. The information that I got came after I graduated. It was stuff that I had to learn on my own. I had to go to seminars and do webinars and do my own research and reading because it's not trained. Okay. So they go and they say, you know, I'm depressed. I can't sleep. You know, I've got mood changes, on and on and on. And unfortunately, sometimes they get, you know, the worst is you get pat on a hand and you say, okay, well, that's just part of getting old.
Yes.
Like, you're just supposed to go ahead and go in a corner somewhere and shrivel up and just fade away. You know, they get the pat on the hand, or you get a prescription for antidepressants.
Yep, I was going to say that.
They said, okay, this is going to help you. Take it, you know, here's a prescription. I've had patients prescribe, you know, neurologic medication, gabapentin. I mean, all kinds of, and the crux of the problem is the hormones. That's what the problem is. It's the hormones. So if you know that hormones is the problem, the fix is replacing hormones. Okay. So that's going to be the thing, that instead of putting a Band-Aid on a problem, you're actually correcting the underlying problem by helping to replace, to support, to help to balance. Yes, you know, I do use for patients who may be like transitional. We of course go into lifestyle changes.
Right.
You know, the foods. I mean, we know the stuff that we're supposed to do, don't we? Okay. No.
We do.
We know we're supposed to, you know, eat healthy. We know we got to keep our body moving. We know we have to hydrate ourselves. But far too often, people don't even realize that they are vitamin deficient. You know, they may have autoimmune problems, you know, that they don't even know, because why? They don't check it. It's not checked.
Right.
Okay. So lab tests are not done. And unfortunately, people go on thinking that, okay, well, let me just go ahead and do this prescription or that prescription. And it's, again, not really addressing the source or the crux of what the issue is.
Wow. So you're talking based what I'm just listening to everything you said. And many of these I've experienced. So I'm listening going, I had no idea that that this was hormonal at all. I'm just going, you know, like you said, older. So I didn't think of it as being attached to anything. Had no reference, and my doctor wouldn't say, I mean, thank God he didn't, you know, some people get prescriptions and they go, well, this is, like you said, due to depression. But they had, if they were tested or anything, they could have maybe not been subscribed that.
Right. Exactly. And unfortunately too, and I'm not saying that there are people that can't, you know, benefit, because there's a lot of people that truly do have issues, you know, with depression and things like that, where they may need to have something to support that part of their health. But again, you know, I've had patients that go on antidepressant and, you know, instead of, they don't feel good. They feel numb. You know, it's almost, it blunts it, you know, it may kind of change the mood where they may not feel depressed, but they don't feel anything. And then they have side effects from that as well, you know, because some antidepressants can cause weight gain. Some antidepressants can even more suppress like libido, sex drive. You know, it has a numbing effect. So you don't feel high, you don't feel low, you don't feel anything. So, you know, again, looking at things from the standpoint of what's going to be the thing that's going to really benefit in the end.
Because I know, like you said about the side effects, like someone told me years ago, they said, if any drug you take has side effects. That is now the determining factors, what you can live with and what you can't, but it's going to be something in that there's a side effect you have to do.
There's something, And again, there's natural things too. I mean, even using again, natural, we talked about lifestyle things, supplement support. There's natural things that can help with some of the symptoms. Yes. I mean, granted, we make recommendations for other natural things that people can use to help with the quote unquote symptoms.
Right.
There are natural things, and we do specific recommendations for those as well, especially women who are more like in early stages where they're not quite ready to necessarily use hormones, but there's having symptoms. So there's a way that we can go ahead and let them use something to help to support, again, because it's a journey, it's a process. It takes time, and you're not going to be the same when you start having those hormonal changes to when you're like really hardcore, like have no estrogen in your system. Because in the early parts, you can be fluctuating with estrogen and have no progesterone. These are just some of the more prominent hormones a woman has. But then later on down the road, you have nothing. You have no progesterone. You have no estrogen. You don't have anything. So again, just supporting and doing whatever is necessary. One of the other points I want to make too is that whether someone decides or not to do anything is not purely based upon how you feel. Because yes, some women we look at it from a standpoint of how can we help you to feel better, okay?
Right.
Others, it's like, okay, we want to help you to feel well, but we also are looking at long-term chronic health conditions that are associated with declining hormones. Okay. So for instance, when a woman becomes menopausal and she loses estrogen, she's also losing her cardiovascular protection. So her cardiovascular health risk starts to increase, and it increases by altering the lipid profile, the cholesterol, high blood pressure risks go up, problems with the cardiovascular, elasticity. So think of estrogen as something that helps to keep the heart, the vessels pliable. So lack of estrogen makes more rigid. The cholesterol profile changes, high blood pressure goes up. This increases a woman's risk for heart problems. And we know that women who use hormone replacement, who start earlier, during that transition time, actually reduce their health risk of cardiovascular problem. So we're talking about long-term cardiovascular. Another long-term health risk is bone loss. Okay. So same thing, estrogen, progesterone, even testosterone helps with bone integrity. So as you get older, that's where the osteoporosis sets in. That's why you fall, you break your hip, your spinal, vertebra collapses because of the lack of the hormones. So, and there's also evidence that shows that, women who are on hormones actually have less risk of even like dementia and Alzheimer's. So again, remember I talked about those cognitive function. We have estrogen receptors in our brain. We have testosterone receptors. So again, long term, the main health things that I look at is cardiovascular, your bone protection, and your cognitive function protection. So these are long-term health. So it's not just, again, I can't emphasize, this is not just about hot flashes and night sweats.
Yes.
This is so much more.
It's big because isn't the number one killer heart attacks?
Yes, yes. And a lot of people are, they don't realize that in women after menopause, that's what kills more women is heart problems, right? We know that.
Wow.
And again, it increases after menopause. It's almost like we catch up to men because we lose estrogen. We lose those protective benefits that those hormones have in our system. So, again, we're looking at multiple things that you could really be benefiting yourself from in the long run. And not only just, being a nicer person.
This a byproduct also.
Well, some people, sometimes I'll like, you need some hormones because And we're laughing, but oh my gosh, the mood changes, snappy, irritable, ain't got no kind of tolerance for people or anybody around you, and all of that. It makes it's part of it.
And I'm listening to you thinking about this. Oh, it's just so much going through my mind. I think with so many people not realizing, period. I mean, number one, well, let's say this. How do we fix this? Let me go there.
Oh, I know. And again, it's not a one size fits all. And that's one of the things that I really, really harp on. This is very individualized as far as the care and management of something like of this. Okay. Again, every woman is going to go through, not everyone is going to have symptoms. Not everyone's risk profile is going to be open to, using hormone replacement, et cetera. But I also don't want people to feel afraid of hormones. Okay.
Right.
Don't be afraid of hormones. You're going to be doing yourself a favor, honestly, by, considering that as a means of helping you. So yes, hormone replacement is one thing, but again, it's very individual because there's a variety of different ways that you can even get hormones into your system. Okay. There's variety. There's a route, changes in the route of administration, the dosing of it. I don't ever use synthetic estrogens. Okay. So the form of replacement is also important. Whether you use synthetic forms versus what we call bioidentical forms, biologically identical, structurally the same as what your body is familiar with. Okay, because something that is exactly the same chemical structure that your body's familiar with, your body's it's a reduced risk with that. You're going to have ways that it breaks down in your system, and those metabolites, we call them, are going to interact with your body the same way it interacted when it was naturally present in your system.
Right.
When you start introducing synthetic forms, say synthetic forms of progestogens like progestin, which and I don't want to get people confused, but natural progesterone is not the same as a synthetic progestin. Okay.
Oh.
So there's forms of the hormone that are safe. You can give natural progesterone to a pregnant woman. Okay. So women who say we have to call a luteal phase deficient, they don't produce enough progesterone after they ovulate. Sometimes they're supported with natural progesterone. Okay. In fact, the word progesterone is pro-pregnancy, progestation, progesterone.
Oh, okay.
It prepares for the pregnancy. So progesterone naturally is something that's the body's familiar with. Right. And it has a lot of awesome benefits to it. It helps you sleep. It's a calming, it's relaxing, it helps reduce anxiety. It's a natural diuretic as opposed to a synthetic progestin. So the form of replacement that you use is important.
Right.
The dose that you use is important. The route of administration is important. Route of administration meaning if you use estrogen through a transdermal route, through the skin, transdermal, through a patch or a gel or a cream.
Right.
What you're doing is you're bypassing the liver metabolism. When you take oral estrogen, it has to be metabolized in the liver. When it's metabolized in the liver, it increasing the clotting factors, which is where risks come in. But if you can use a transdermal route versus a pill form of estrogen, you bypass the liver metabolism. And again, you reduce your risk, you get the safest route of administration, and you're able to alleviate all of these things that we've been talking about. Okay. Alleviate. And I'm big on alleviation. Okay. Alleviate it all. So that's what we're looking at. And I don't want to understate using other lifestyle things. So yes, if alcohol is going to be a trigger for flashes. Okay.
Right.
You know, not keeping a healthy weight is also a trigger. It's also risk as well. So these are things that do matter, but I don't want people afraid of, again, natural, bioidentical, the same that your body is familiar with, replacement, especially in the early stages when people are transitioning. There's no need to suffer. If I can just put it that way, there's no need to suffer. There's no need to be sweating and irritable and depressed and can't have sex with your husband because everything hurts and you don't have any drive and your hair's falling out and your bladder's weak and on and on and on. You don't need to go through that.
Wow. And a lot of it is just because you don't know. That's all it is. A lot of it.
And that's why stuff like this, putting this out, informing people so that they can know.
Yeah.
Okay. Because like I said, they go and they may not, they may see a doctor that hasn't kept up with research that has happened since 2001 when all the scare started scaring everybody, letting them think that hormones are evil. Hormones are not evil. You got to get out of 2001. Okay. There's a lot of information that has happened since then. Lots of research supporting the use and how it can help with your overall health and your wellness.
So you're saying the transdermal is the way to have it in your body as opposed to the pill form?
As opposed to the pill. And and it's specifically talking about estradiol. But progesterone can be taken orally because that one actually has the benefit of the sleep and the breast protection, uterine lining protection, you know, anxiety, calming, relaxing. So you need to find someone, you know, that's able to, that knows and understands and takes everyone's situation individually. And is very specific in the choices and the way that we choose to help them and help to support them.
Well, I can tell too. So, ladies and gentlemen, because she didn't know I was going to say this, by the way, but Dr. Leita is local for the IE, but she's a speaker, you know, all around the world, really, on this topic. That I would say, if you're in the IE and you're looking for an expert, please go and see her. Dr. Leita Harris. She is. Are you think you're Corona?
I'm in Corona. My office is in Corona. Yes. Yes.
In Corona. Support her. This is a lady. I mean, all this good information. I'm just sitting here going, wow. I know I have done suffering as far as the snapping and all. I'm just listening to this going, oh my goodness.
You're like, I identify. But you know something, you know, and I'll be, you know, I'll be 64 in a couple of months. I'll be 64 years old. And I went through personally at 47. And my version of it, when I was talking about can't think straight, can't focus, memory, all that stuff, that was me all day long. And when I started dealing with the hot flash part of it, it was crazy because it was during, get this, it was during a summer when the AC in the house went out and the AC in my car went out.
Oh my God.
So I was going to work. This is what I would do. I would get some wet towels, okay, wet and rags, cold rags. And I would leave my house. I'd put a rag around my neck. I put a rag on one side. I put a rag on the other side. Put a rag on this arm and a rag on this arm. And that's how I was trying to get to work. Just so I could try to cool down. That's how bad it was. I mean, that was the sweat part of it. And then that's like, I couldn't get to work as quick enough so that I could get into some AC and blow the fan on me. But the scary part was this part. Yes. I couldn't talk. Well, I felt like I couldn't talk straight to my patients. Like I was forgetting stuff. When the words in the end of my sentence would just, I'd say, float into atmosphere somewhere. I couldn't find the word. I mean, I'm thinking I'm going through dementia. I'm like, oh Lord, I mean, my mind, I was like, help me, Lord, because that was the scary part.
Yeah.
Hot flashes, that's one thing. Yeah, I dealt with all the other stuff, everybody, but when my mind started like drifting away, that was scary. I'm like, oh no. I was like, heck no, I cannot function like I can't function.
I remember
That is forget. I was like, I'm getting on hormones. I do not. I have to do something back because I had to function.
yeah.
And that was 47. Like I said, I'll be 64 next month, and
Oh,
I ain't going back. I know what it feels like to be off, and I know what it feels like to be on, and I am not going back. So let's just put it that way.
I could not remember the code to our security. So in our home, I'll never forget. I stood there and I was like, I know this. Why can't I not remember to turn just to something simple? This was, I must be honest, that scared me so bad.
Yes, yeah.
I do day in, to whatever, just to turn the alarm off, whatever, and I could not remember it, and I was it was scary, and I did start thinking, well, maybe you're going through. I didn't know what to think. I said maybe
I don't know what to think. You're right. It's hard to know what to think because you don't. But
yeah, but you're scared.
This is what's going on. This is what's going on with us.
I need my mind. I was like, I can do it out of a couple of things. I need my mind.
I need my mind. Thank you.
I know, but it was so scary. I literally stood there and I kept thinking, I know. Why is it not coming to me? Why is it? It's only, that was so scary for me.
Yeah, it is. It is. And, sometimes people are able to kind of manage through, and there's other natural things that people can take for their brain function and things like that. So it's not an impossible thing to be okay without. Right. I just like people to understand. Now, what you choose to do with the information is up to you, but understand why this is happening to you. You see what I'm saying? That's the main thing. Understand what is going on with your body. Understand that this is why all of those things are happening.
Right.
And understand that there are options for management, and understand that there is no need to suffer through it. People have been told, hey, it's going to go away. It's going to go away. And then it's like, I have people that have been literally suffering for 5 years, and they are just like a shell of a person. They're drained, they're crying, they're frustrated. Sometimes their husbands are with them and like, I just want my wife back. It could be a very out of body experience. Like, you don't know what's going on with your body. And to be able to just say, don't worry about it. It's just your hormones. I can help you. I can help you. Let's go ahead and start this journey. Let's get some lab work. I do a full comprehensive panel because I'm not just looking at hormones. I'm looking at their metabolic state. I'm looking at vitamin deficiencies. I'm doing a deep dive and looking at thyroid problems, et cetera. So there's ways to assess and then go over risks and benefits, different routes of administration, and work with the patient to see what would be the best thing for them. And let me tell you, when they come back in here and they're like, and they saying, I saved it, I'm like, glory to God. They're like, you saved my life.
Yeah.
You saved my marriage.
Yeah.
You saved my mind, and on and on. It's like they're tearful, but tearful with joy. I'm saying, I can't believe how much of all of what was going on with my system was related to this. You don't even realize, because sometimes things are so subtly happening over time. And until you start correcting things, you don't even realize, this was because of my hormones too. This got better. Oh my God, that got better.
You never hear, this is not something that you're going to learn in a classroom.
No, it's not. No.
So people, and I'm sure they said you saved their life. They had to say that because I won't say they had to say that, but they so grateful.
Yeah.
They didn't know what it was. they knew it was something, but they didn't know what.
Right. Right.
Oh,
Right.
I can
Right.
only imagine that they would feel like that. And we have some comments from the super fans, and one is from our executive producer, and he wants to make a comment. That is Oliver. He says, "Dear Dr. Harris, welcome to the show. Thank you for your expertise and knowledge in your field, and thanks for thanks to our weekly
Brother Oliver. How you doing?
All right, and Nanette, that has where have you been, Nanette? You said, I recall when asking my mom about her experiences with menopause, she said, I don't remember having any problems. She was a tough cookie, a true superwoman, but no fuss to her physical changes. That's what she said.
Yes.
Uh-huh.
And I appreciate Mitchell saying, because there's a lot, whether someone has anything or not is as variable as there's a number of women. Because you have some people on one end of the spectrum that, it's almost like the period just went, like somebody just turned the faucet off and they just coast the rest of their life and had no problems. They're fine. Their body just handles it well, no problems whatsoever. But then you got 80-year-old women still fanning themselves. And everything else in between that they may not have even, again, acknowledged, because people just take aging. I'm like, oh, I'm just getting old, and they just accept the body changes that's going on. They accept it.
Yep.
And they just go ahead and function, and it's whatever about everybody else in their life, whether they can do it or not, so.
And I think that it's because we don't know. No, it's not like I don't remember my mother talking about it, my aunts talking. No, not even a comment.
Right.
I see a lot of is the ladies with the fan, like you see, they'll be fanning themselves, or they have a fan, the little fans that they have. And so that's what I see. Or someone say, I'm having a personal summer.
Oh yeah. Oh yes. Oh yeah.
So it's so different ways we describe it, but we don't know that you don't have to suffer through. You don't have to do it.
Right. Right.
And Lavinia said, I have been on
bioidentical hormones. That's good.
For years, and now it's like living a new life. My gynecologist said that there was no silver bullet, but you just have to go through it. They had nothing for me.
But he found somebody to help her with some bioidentical hormones.
Right.
So
early,
right.
Hysterectomy.
Right. So Lavinia, she's basically sharing that sometimes people go through surgical menopause. So it's kind of like remember I said there's no more ovarian production of their hormones.
Right.
So if you have chemotherapy or you have a surgical removal, then you're basically having surgical menopause. So immediately, once the ovaries are gone, there's no more hormonal production from the ovaries because it's no longer there. And so those are obviously people that are going to be, depending on what the reason was for the hysterectomy, that they can basically say, hey, from now I can go ahead and do something, but then also making sure that it's balanced, so I'm just happy that she's saying that she's on some hormones. So that's good. And it saved her life.
Yes. And then that says so many years, women I know fighting cancer are given estrogen suppressant.
Yes, right. And so basically, there are going to be some contraindications. So if you have an estrogen sensitive tumor or whatever kind it is, then you can't use estrogen. Because see, she's talking about women who are fighting cancer. So if you have an estrogen sensitive tumor or cancer of some sort, you can't give estrogen because that's going to stimulate the growth. And so they are on estrogen suppressant to stop estrogen. But there are ways, and here's another thing. There's actually been studies, like say, for instance, and I'm going to specifically address this, that there are people who they have just vaginal atrophy, terrible thinning, painful, can't even be intimate because of the fact that they're on estrogen suppressing medication. So there are ways that you can help. And there actually have been studies to show that even a little localized estrogen, someone who's not currently in treatment or whatever, can help with the vaginal tissue and with the bladder. So, but you got to work, with someone who knows, work with the oncologist that said, I've spoken to oncologists, I've read books, I've read research. You can use a little local vaginal, not taking it systemically where it's going to be absorbed in your bloodstream, where it can stimulate any potential tumors or cells that may be estrogen sensitive, but you certainly can do something locally to help with the vaginal tissue. So it's not for everyone. I'm not telling people it's for everyone. Again, I just want people to know that it's out there. Again, I don't want to be redundant. Understand what's going on with your body, why it's going on with your body, know your options for management, and then be very individualized in the approach in whether or not you're a candidate or not. But don't shun it. Don't shun it, and don't suffer because you feel like somebody's going to give you a crown because you suffered.
Because they're not.
I put it on one of my posts because I on my Instagram page, Dr. Leita, on my Instagram, I put a few. I said, "There's no crown of suffering for menopause." We talk about different crowns that we gonna get on it. And once we go on to see the Lord, there's no crown of suffering for menopause. Nobody's gonna give you a crown. Oh, the queen of suffering through menopause. No, it's not. But just understand. Again, it's just the information, it's the knowledge, is to help women help each other, and also help the men to understand what's going on with their women.
Yeah.
Help them understand what's going on. It's like, no, she's not just being a certain way. There's something going on with her.
Wow.
So help her to seek the right care, to be able to do something to help herself.
Because what I have heard a lot, unfortunately, is women being called the B word.
Oh.
Because, and I can almost, without a doubt, it's going to be an association with this time in life because of the snappiness, like you said, the snap back stuff. Not people. I've heard people actually say, "I don't care what they think," and I'm like,
right.
What I said to people. Everybody cares what people think. So don't ever saying that is going to make it. We all care. We do. Right. We do care. We don't want to. I don't want to just hurt people. But anyway, this is Ruby. And Ruby is an actress. I met her she's in Maryland. Well, I don't know. You could be on the East Coast. On the West Coast, Ruby. But Ruby says, great show and great guest today. Mary, I'm going to be in the yoga class.
Yay.
All right, Ruby.
Enjoy the yoga class. That's awesome.
And Elaine is a retired educator. Elaine says, I'm so glad that I'm hearing all of this info. Today, I will have my daughter and my nieces and sorority sisters and friends. Yes. Thank you, Elaine. I'm glad. And this is Denise. Oh, hi, Denise. I haven't seen Denise in a while. Denise says, hi, Mary and Dr. Harris. Are some doctors unwilling to provide medication for those with hot flashes?
Yes, there's doctors all over the place because they haven't been. They and I will say this very much because I have patients come to me because they've already gone to try to seek this. It's not uncommon for someone to go to multiple doctors, their primary doctor, their GYN or whatever, trying to seek help, trying to seek support, trying to seek some kind of resolution to what they're dealing with. And again, they get the pat on the hand, they get misinformation, they get misinformed, they get scared, they get wrong information. And so they're not willing to help it. And then eventually they wind up in my office, okay? Or on telehealth, because I do telehealth appointments, so they wind up and it's like, but so I get it. I understand what's going on.
Right.
I understand what is going on because people, they don't stay up to date. They're afraid. They don't understand the benefits. They don't understand how to even prescribe it. Honestly, so you do have to really be mindful of finding like people who are, and I'm not saying I'm the be all and end all, but you find someone who is a specialist,
right?
Who has studied this, have lots of expertise with it in management. I mean, I've been doing this, like I said, for decades. And so there's a variety of different ways that I've been able to help. And it's just my passion, because I just feel like too many people are just overlooked and just given the wrong information and made to feel like something wrong with them. And I'm like, no, it's not wrong with you. We know what's going on. This is not confusing. We know what's going on.
But they're suffering many times in silence.
Absolutely. Oh, no question. No question, because there's not a lot of talk. Now there is a movement, if I could put it that way, happening now where it's more open, and like, because social media and stuff like that is reaching more people. Okay. Right. So there are a lot of people who have very loud voices, large social media platforms and things like that. There's NIH studies that are being put out, the funding for that. There's people that are writing books like on the new information that's out there. You see, so there is a movement, and the way I like to put it is that the next couple decades of women are going to fare way better than the last 2 decades of women as it pertains to managing this phase in their life. They're going to fare better because it's more vocal. People is talking more. People feel comfortable. Like, oh shoot, I'm dealing with the same thing too. Yeah, we're sharing it with their friends. Like she was saying, my sorority sister, my nieces, my grandma, my daughter, share it, talk, open. Let's have that conversation. Wow, that's what's important. That's what's imperative, is to have the conversation so that people understand what's going on and be able to, yes, like she said, advocate for themselves. Yes.
Knowledge is power. That just the information I've learned so much today, and then we can advocate medically for ourselves. I think without a doubt, nowadays, when I was growing up, whatever the doctor said used to be gospel. Right. Now it's almost like the other way. If the doctor says something, you go research. Right. That's what I see. That's what I noticed. It's true. Look up what the doctor said. I know I didn't. I just assume if they said it, they have the education and that's it. But now, no,
things have changed. Things have changed, and I think it's good. That's good, because not everybody has not everybody stays and knows that what their expertise is or is not. You see what I'm saying? So you got to know what if someone comes to me and they got a certain issues, I at least need to be able to recognize it so that I can know, okay, I can't help you, but let me send you to somebody who can.
Right.
You see? So,
and this is Lavinia saying, Lavinia says, so glad to see this information is getting out to so many. God sent me someone who referred me to a doctor who could help me. When I had my gynecologist about, where am I?
About the benefits of bioidentical hormone implant. Yes, I do pellets. Yes, she does pellets. I do pellets. That's why I've said different routes of administration. He was surprised and wanted to know more about that. I've been on these hormones 13 years. That's right, Lavinia. I have women that because pellets is another way. I mean, I didn't want to get into that, but pellets is another way of getting estradiol and testosterone replacement. It's just you put it right underneath the skin and it slow releases into the bloodstream. I don't even want to get into that. Like I said, there's a whole lot of ways to do what we do. Wow. You just got to know how to do it. And the most senior patient I have, she's 88 years old. And honey, she comes in every 6 months and gets her pellets. And she's been on hormones way before I even started giving it to her. But she's 88 years old.
What is your number before we go? We down to 2 minutes, but I want to put your number in there.
So my office number is 844. I can write it in the chat. Should I give it to the chat?
Yeah, you can.
844-845-8737. Okay. And and then I'll just put like my website and my Instagram is at Dr. Leita, so they can follow at Dr. Leita, my website, phone number. So it's on a private chat, but I guess you can put that up whenever. So so
there it is. Let me see. And can they see that? I don't know if they can.
No, it says private chat, but I don't know.
I think I have to highlight it, and then I think I can put it in there. Let me put it in the chat. Maybe that's what I have to do. I'm doing it right now, ladies and gentlemen. There. hope you guys can see that. I think you can. There we go. Did it go online? Because I did it real quick, so I don't know if it want to make sure you do see it. Okay.
Yeah, I don't know. I don't know. It says private chat, so I don't know where it goes. So, do you want me to put it on the thing here?
There you go. I got it up there.
Okay.
So, ladies and gentlemen, take a screenshot because we have exactly 1 minute, and I want to make sure you get this information. And I want to thank you, Dr. Leita, for coming today. It is an honor and a privilege to have you here. I do appreciate you more than you'll ever know. But the feeling of just knowing you were, I've always known you were there. Don't get me wrong.
Oh yeah, we've been knowing each other is there. So I appreciate you giving me the opportunity to share with the women and just to, thank you for hosting something like this. It's very important for women to know and men. So thank you so much. I appreciate you.
So we're going to have you come back again one day.
Okay. God bless.
All right.
All right, dear. You take care. All right. Bye-bye now. Thank you.
Ladies and gentlemen, that's our show for today. Thank you for coming. Next Monday, we will have a new show, a new guest for you. I appreciate each and every one of you. Please share the show out and also make sure you go and subscribe to the YouTube channel. I'll see you guys next week. Bye, everybody.